Understanding levothyroxine can feel overwhelming, but it's key to managing thyroid health effectively. Let's break it down, step by step. Levothyroxine is a medication that acts like the hormone thyroxine, which your thyroid gland normally makes. When your thyroid doesn't make enough of this hormone, your body can feel sluggish and tired. Levothyroxine helps by filling in for the missing hormone, keeping your body's engine running smoothly. It's used to treat hypothyroidism, which is when the thyroid gland is underactive. This medication is important because without enough thyroid hormone, things like growth, heart rate, and energy levels can be affected. Levothyroxine works by stepping in as a substitute for thyroxine, the natural hormone your thyroid should produce. Once inside your body, it travels like a delivery truck to where it's needed most. It enters cells and heads straight for the nucleus, the cell's command center. Once there, it attaches to thyroid receptors on DNA. This is like a key fitting into a lock, which then opens the door for your DNA to start making proteins that keep your body energized and functioning well. Inside the cell, levothyroxine transforms into triiodothyronine, or T3, which is the more active form of the hormone. Think of T4 as a caterpillar transforming into a butterfly, T3, ready to take flight. T3 then binds to nuclear thyroid receptors, guiding the production of messenger RNA, the instructions for building proteins. These proteins help regulate your metabolism, which is like the speed at which your body's engine runs. By ensuring that your body has enough T3, levothyroxine helps maintain a normal metabolism. This means your body can efficiently use energy, regulate temperature, and maintain a steady heartbeat. It's like setting your thermostat to the perfect temperature, not too cold, not too hot. This balance helps you feel more energetic, improves concentration, and can even affect how your hair and skin look. It's important to take levothyroxine just as your doctor prescribes. Usually, it's taken once a day on an empty stomach, about 30 to 60 minutes before breakfast. Think of it as giving your body a head start for the day. Avoid taking it with certain foods or medications that can block its absorption, like calcium or iron supplements. Always discuss your full list of medications with your doctor to avoid interactions. While levothyroxine is generally well tolerated, some people might experience side effects, especially if the dose is too high. These can include feeling jittery, having a fast heartbeat, or trouble sleeping. Imagine drinking too much coffee. That's similar to how your body might feel if it's getting too much thyroid hormone. If you notice anything unusual, it's important to talk to your doctor. In rare cases, some serious side effects can occur, like chest pain or a rapid heartbeat. These are signals that your body might be getting too much hormone. It's like a car engine revving too high, which can cause damage if not addressed. If you experience these symptoms, seek medical attention promptly. Levothyroxine can interact with other medications, which can affect how well it works. For example, certain antacids, calcium, and iron supplements can block its absorption. It's like trying to get a message through a traffic jam. It slows things down. Always inform your doctor about all the medications and supplements you're taking to prevent these interactions. Levothyroxine is supplied by several manufacturers, including AS Medication Solutions and Amneal Pharmaceuticals. Each company ensures that the medication meets strict quality standards to be safe and effective for use. It's like having different brands of the same essential tool, each crafted to the highest standards for reliability. Regular communication with your healthcare provider is key to effective treatment. They'll monitor your thyroid levels and adjust your dose as needed. Think of it as fine-tuning a musical instrument to ensure it plays perfectly. Keep them informed about any changes in your health or if you start new medications. Understanding how levothyroxine works can help you manage your condition with confidence. Always follow your healthcare provider's advice and keep them informed about your progress. Remember, you're not alone on this journey. Stay informed and take care. This video is for educational purposes only. Always consult your doctor or pharmacist for personal medical advice and before starting or stopping any medication.